the death rattle. And what is it? Some of you may have heard of it before, some of you may not have. That is one of the signs of near end of life. This is because your loved one's organs are shutting down and they can't function the way they typically do, especially when it comes to swallowing. So it is more upsetting for you as the family member. Your loved one is not suffering. They're still breathing. They are near the end of life, and this is a very difficult time for you. One of the things typically in your comfort pack that you got during hospice, you should have gotten at the beginning of coming on hospice, is hyoscyamine, which is also called Levsin by brand name, which decreases secretions. Now, mind you, if your loved one has been having secretions for days, there's also a hyoscyamine patch that can be put on the arm if the oral pill isn't working, or if you're having to crush the pill and put it under their tongue. Now, one of the things I want to share with you in real life experiences, I get these calls all the time. You know, there's all these secretions. What do we do? We've used the hyoscyamine. So in those cases, there's a couple of options. I'll tell them to turn the patient on their side, use the mouth swabs. If that has been ineffective, then we will sometimes order suction. It is a possible thing to do. Now, I just want to give you a little example of a situation I had a few years ago. I had a family that called me that I was just such a nice family. They stick in my head, and they had called me explaining the secretions. And, you know, sometimes as a hospice nurse, you feel a little bit helpless because you know you're not going to stop any of this. And so I advised them to turn them on. So I advised him, you know, to give the Levsin, and they said, okay. And sadly, the person passed that night, and I had to go out to pronounce him. Now, I don't want you to get upset, but I want you to know what realistically can happen. When I got there to provide the postmortem care and I had to turn him, literally just secretions poured out of his mouth. And the son was helping me, and he was trying to get things to clean it up. So secretions can get copious. Your loved one is not suffering. They're not realizing this is going on, okay? If they were, they would be agitated, and we'd have to get some sort of anti-anxiety or terminal agitation medication on board. But that wasn't the case in this situation. So I just want to tell you, some people don't have secretions at all near end of life. Some people have mild, they are treatable with the hyoscyamine, and others are just copious where we have to order suction. So don't get upset. Your loved one is not suffering. It's more stressful for you to hear them and to feel helpless, but you're doing your best, and that's all that can be expected. You're honoring and caring for your loved one. I did leave on PayHip a guide that you can purchase to see the 10 signs that your loved one is at the end of life, because it's a very difficult thing to deal with. So at any rate, yeah, feel free to go there. Look in my bio for my handle at PayHip. I hope it's helpful to you, and because I know it's one of the most stressful parts of being on hospice. And keep tuning in for more information. I'm going to keep trying to give information because I really feel passionate about this. Okay, peace.